Welcome and thank you for joining. My name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. Today's webinar, Cold or Flu, is presented by Melanie Bettenker from Community Health at Atlantic Health System. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or the chat for comments. We will try and get through all questions at the end of today's presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources or additional dates and times, please call 1-844-472-8499. I am now going to turn it over to Melanie.
Hi, everybody. Let me share my screen for all of you. Okay. Let me know, Ashley, if you're seeing the PowerPoint, not my Teams. Okay, cool. Today's presentation is about cold or flu. Question mark. Just a quick disclaimer, the content of this presentation is intended to provide basic knowledge and to help you increase awareness of available resources. It is not intended to replace the medical advice of your care team. If you have specific questions related to your personal health and wellness, it is recommended that you reach out to your primary healthcare provider who can review your personal health history and tailor recommendations to you. If you are in need of a primary care provider, please let us know at the end of this program so that we can connect you to resources. The presenter, me, of this program is I'm a health educator. A health educator is not able to answer questions related to clinical diagnosis, follow-up, or treatment. Just a quick disclaimer. So what is the learning objectives of this presentation? By the end of this program, my hope is that you will be able to identify the contagious period of influenza, identify at least 2 differences between cold and influenza, demonstrate proper hand washing techniques, and recall at least 2 preventative techniques to reduce the risk of illness. Here we are. We're going into the season. Well, we are in the season of respiratory illnesses. Lots of sniffles and sneezes, but what is making you sick or causing those flu-like symptoms? There are a few common culprits that can cause similar symptoms, but have different treatments, along with a few other signature symptoms. These include bacteria infections, such as strep throat and whooping cough. Bacteria infections are treated with antibiotics. And viral infections are like such common colds, COVID-19, and flu, which are viruses that should not be treated with antibiotics and should be treated with antivirals or just the regular getting better treatments. Viruses are not treated, again, with antibiotics. It's important to see your healthcare provider when you're ill because some illnesses may be caused by either bacteria or a virus, and your healthcare provider can help you determine what is the best treatments that could be. So here is a great depiction in this CDC chart. And on the common respiratory infections, what causes them, and if antibiotics are needed. As you can see, common colds, sore throats, except in the instance caused by strep, COVID-19 and flu are all viruses and no antibiotics are needed. So for instance, common colds, runny nose, sore throats, COVID-19, and the flu are viruses. And bronchitis, middle ear infection, sinus infection can be caused by a virus or a bacteria. And strep throat and whooping cough are caused by bacteria. So let's start with a quick basics lessons on the differences between bacterial infections versus viral. Bacteria are single-celled organisms that thrive in many different types of environments. They're very common and the most numerous of them all. Some varieties live in extreme extremities of cold or heat, those different extremes. Others make their home in people's intestines where they help digest food. Many types of bacteria cause no harm to people, but there are also exceptions though. There are some infections caused by bacteria. Those include, like I said previously, strep throat, but also tuberculosis and UTIs, urinary tract infections. Most common treatments for infections caused by bacteria, though, is treated by antibiotics. Antibiotics are important to treat infections and have saved countless lives. However, inappropriate use of antibiotics have helped to create a strains of bacterial diseases, which makes very dangerous and because it's very hard or impossible to treat, that make it resistant to treatment. This can create more resistant strains of these illnesses and is an example of restraint strains like multi-drug resistant tuberculosis. When antibiotics are needed, the benefits using outweigh the risk of the side effects or antibiotic resistance. However, too many antibiotics are prescribed unnecessarily and misused, which threatens the usefulness of these important drugs. This is why it's important that we all use antibiotics only when we need them to protect us from harmful, non necessary antibiotic use and to combat antibiotic resistance. So, a little bit more of the basics viruses. Now that we have covered most of the bacteria basics, now we're going to cover the virus basics. So viruses are even smaller than bacteria and require living hosts, such as people, plants, or animals, to multiply and spread. When a virus enters your body, it invades some of your cells and it takes over the cell machinery, redirecting it to produce the virus. Common diseases caused by a virus include common colds, most common virus to cause a rhinovirus, influenza, stomach bug, aka norovirus, COVID-19, and respiratory syncytial virus, RSV. Treatments will vary depending on the type of virus. In some instances, there are antiviral treatments, like previously mentioned, that can be prescribed, but antibiotics are not useful in treating viral infections again. Typically, treatment will include managing symptoms with rest and fluids. It is important to note that sometimes it may be difficult to determine whether you have bacterium or virus that is causing your symptoms. When elements such as pneumonia, meningitis, and diarrhea happen, can be caused by either type of microbe, so either bacteria or virus. So let's talk a little bit more about those viral infections, the common cold, influenza, stomach flu. So let's do a quick dive into some of those vibratory or respiratory infections, which listed on the slide. So the common cold is commonly caused by various different viruses, but rhinovirus is the most common culprit, causing about 50% of cases. It is spread to person through exposure to respiratory droplets, secretions, such as coughs and sneezes, sometimes are similar to flu with a few key differences between the symptoms, common on gradually and are typically very mild. You are more likely to have a runny or stuffy nose with a cold, but you rarely get a fever. There's no vaccination for the common cold, and the best way to prevent it is through hand washing. And hand washing is proven evidence that is better through water and hand soap rather than just using hand sanitizer. Influenza or flu is also spread person to person through exposure to respiratory secretions, such as coughing and sneezing, sometimes are abrupt, and fever is usually with a flu. You can also expect feeling achy, and many people report also headaches or migraines. You may be able to take antiviral to shorten some of the symptoms, but the best way to prevent flu is through annual vaccination. While stomach flu is common occurrence during the season, it is important to note the norovirus or the stomach bug, while sometimes called the stomach flu, is not related to the influenza. It causes acute gastronitis with symptoms that include diarrhea, vomiting, and stomach pain. It can cause severe dehydration it can even cause severe dehydration as a result of those symptoms, and it can stay infected in surfaces for days or weeks. There's no vaccine or antibiotics that are ineffective. The best way the best way to prevent it is, again, hand washing with soap and water and disinfecting the surfaces. Again, let's talk about more viral infections like our COVID-19 and RSV. So the COVID-19, from what we know, COVID-19 spreads more easily than flu, and it's spread person to person through exposure of respiratory droplets. Again, coughing or sneezing. Compared to people with flu, people infected with COVID-19 may take longer to show symptoms and may be contagious for longer periods of time. Those infected with COVID-19 can spread infection 2 to 3 days before symptoms begin, but COVID-19 can also be spread without having symptoms, right? So prevention, staying up to date with the vaccinations. Everyone 6 years and older with one updated Pfizer or Moderna vaccine are considered to be up to date. So let me read that again. Everyone 6 years and older with one updated Pfizer or Moderna vaccine are considered to be up to date. Hand washing and good hygiene practices, another forms of prevention. Respiratory syncytial virus, RSV, spread person to person. Another one that's spread to person through coughing or sneezing, so also by respiratory droplets, direct contact, or contact with objects or surfaces with the virus on it. Incubation period, 4 to 6 days. Almost all children are first infected before 2 years of age. They repeat infections that can occur at any age. The best prevention, again, hand washing, disinfecting surfaces. And also, if I'm not incorrect, good hygiene. Of course, it's good hygiene practices and vaccines that are available for older adults and those who are immunocompromised. Usually goes away on its own, though. So another chart. This chart is a very good, interesting one because it lists the different symptom onsets that these different viral infections can occur. So I want to highlight again that with the flu, the onset is typically abrupt and it comes with a fever that can last 3 to 4 days. And it's common to have aches, chills, and fatigues, but you're less likely to have sneezing, stuffy nose, and sore throat. While cold, the symptoms come on gradually. Sneezing, stuffy nose, and sore throat are common, and it is rare for you to get a fever. So if we want to look at the chart in comparison, influenza, cold, COVID-19, RSV, for example, the symptom onset for influenza is abrupt, like I just mentioned. Cold, it becomes gradual symptoms. And you tell me, because I just got over a cold, it is definitely gradual. And COVID-19, the symptom onset is 2 to 14 days after contact, gradual onset with sudden escalation. And RSV is mild with a sudden escalation. So you can even read the rest of the chart for you, but each one's onset of symptoms are different and when and how. And just to answer any questions, Yes, this PowerPoint will be sent to you in a PDF form by Ashley. Because I know these charts are cool. Okay. You may be able to pass on the flu to someone else before you know you're sick, as well as while you're sick. Although people with the flu are most contagious in the first 3-4 days after their illness begins, some otherwise healthy adults may be able to infect others beginning 1 day before symptoms develop and up to 5 to 7 days after becoming sick. Some people, especially young children and people with weakened immune systems, might be able to infect others with flu viruses for an even longer time. People are most contagious the first 3-4 days. True. People who have flu often feel some of all these symptoms: fever, chills, muscle or body aches, headaches, fatigue, cough, sore throat, runny or stuffy nose, vomiting, and diarrhea, which are more common in children. And it spreads person to person, so up to 6 feet away. So there's flu complications, especially if you don't tackle it and treat it right away. Um, Most people who get influenza will recover in several days to less than 2 weeks, but some people will develop complications as a result of the flu. Complications can include infection of upper respiratory tract, like nasal passages, the throat, and lower respiratory tract, like the lungs. This can also cause sinus and ear infections, which are another complications of the flu. Those are examples of moderate complications. Pneumonia is another complication of the flu, either influenza virus infection alone or from co-infection of flu viruses and bacteria. Another complication is inflammation of the heart, the brain, or the muscle and the tissues. Another complication of the flu is multi-organ failure. For example, respiratory and kidney failure. Extreme inflammatory response in the body can lead to sepsis, the body's life-threatening response to infection. Sometimes, and also when you want to talk about symptoms, always, symptoms of sepsis can include a combination of any of the following: confusion or disorientation, shortness of breath, high heart rate, fever or shivering or feeling very cold, extreme pain or discomfort, or clammy or sweaty skin. Flu also can make chronic medical conditions worse. For example, people with asthma may experience asthma attacks while they have the flu. And people with chronic heart disease may experience a worsening of this condition triggered by the flu. Which many of these complications are rare, it's important to know about them, particularly if you're someone who is increased risk of complications. For instance, for those who suffer with, for example, hyperglycemia, the form of diabetes, or other related diseases, you know, your blood sugars can be out of whack during those flu illnesses and indoor complications because your your immune system is compromised, so your body is not being balanced. So, what should you do if you get sick? Most cases of the flu causes mild illness, and medical care, including antiviral treatments, are not needed. When infected, you should stay home and rest. I know that we want always to come to work because we feel like we're obligated, or school, or to whatever commitment we have. However, your health is always first above anything going on. Everything else can wait. So stay home and rest. Avoid contact with others to avoid spreading the flu. Drink plenty of water and other liquids. Wash your hand and disinfect surfaces you touch. In rare cases, severe symptoms may need immediate treatment. In adults, those would be difficult breathing or shortness of breath, pain or pressure in the chest or abdomen, sudden dizziness, sudden confusion, severe persistent vomiting, flu-like symptoms that may improve but then return with fever and worsen with cough. Note, A list of symptoms and emergency warning signs of flu complications in adults and children can be found in the link that is going to be shown once you guys the PowerPoint in certain sections. So going back here, if you are in high risk group having severe symptoms or symptoms or generally worried about your illness, you can always connect with your healthcare provider. So it's important to seek out your doctor. They're there to help you, tell them your symptoms, tell them your concerns, as well as if you're going to stay home from school or work, you're gonna need that note as well. But before they can do that, they gotta see you to treat you and advise you what you have and stuff like that, what you can take or not take. So it's a good idea to have your primary care doctor whom you see regularly. Those are the ones you're gonna reach out to when you are sick. They're often the first person you can visit and speak with regarding your wellness needs. And reminder, certain the viral infection and bacterial infections that we mentioned are who you will call first is your primary care doctor, not so much going straight to the ER unless the severity that could determine that. But also if you want to know if you had to go to the ER or not, again, contacting your primary care doctor is needed. If you do not have one, primary care doctor, there are ways to find primary providers in your network. You can start by either calling your insurance company for a list of local covered healthcare providers and then calling the office to see if they're accepting new patients or by finding a physician based on a recommendation or double checking their network before booking your appointment. Always make sure they are cover your insurance before setting up an appointment because getting billed is scary. If you're unsure, there are clinics and other options such as charity care that can help you as well. And if you're uninsured but you are eligible, there is for example, social workers, community health workers that can help you apply. And if you don't have means to even apply, then just charity care would be the ideal. When you do have an appointment, your provider may offer an e-visit, like online virtual visit, like telehealth. The option works best if you're not feeling well enough to leave your home. It's hard to schedule a doctor's visit into your day. When you're on vacation, you probably get sick on vacation. You need to know what to do. Or your provider will offer an office appointment depending exactly what you have and stuff like that. Check with your insurance company again regarding coverage for telehealth as well. Coverage and fees may vary from office to office, so that's another thing to consider when calling your insurance company. Like ask them what providers cover your insurance near you, but as well as may ask them if telehealth like virtual consultation is needed, would they cover like before you hang up. Okay. So prevention is key. Now that we talked about the flu and other respiratory illnesses, let's focus on what you can do to keep healthy and prevent these illnesses. Let's do it. So prevention is key. Flu vaccination. The annual flu vaccine is the most effective way to prevent the most common strains of flu and is recommended for most. It contains an inactive form of the virus, and it is important to note that you will not contract the flu from the flu vaccine. Many people experience side effects, usually mild and short lasting, that can mimic flu symptoms. These may include headache, fever, muscle ache, soreness at the injection site, nausea, and fatigue. But again, these are not symptoms that you have gotten in the flu. It is the response of your body as it develops the necessary antibodies, such as the defense mechanism against the flu. So to also add to that, many people well, what's the point of getting the flu vaccine if I'm still gonna get the flu? It's not supposed to prevent, but it's supposed to help most strains of the flu. And for example, when you have a flu vaccine, your body is able to create defense antibodies faster to have less complications and less long lasting of the flu symptoms and all that. So that's something to remember. There are different variations of the vaccine. Ask your healthcare provider which vaccine would be best for you. Also depends on your what you're allergic to and stuff like that. The most common vaccine given is a quadrivalent vaccine, which protects against 4 strains of flu, those which are currently circulating and or predicted to circulate. There is also the high-dose seasonal influenza vaccine, also known as a Fluzone, which is a trivalent infective flu vaccine recommended for those 65 and up. Unless severe allergy to vaccine or eggs, then it contains 4 times the antigen of the standard dose to create a stronger immune response, especially for those 65 up and those immunocompromised. They generally get the Fluzone because there are 4 times of the antigen of the standard dose, so which creates a stronger immune response. And it's also important to know that it's unsafe to get both a COVID vaccine booster and a flu shot on the same day. If you are due for both and would like to receive, the flu vaccine is offered in many locations, such as your primary care provider's office, local pharmacy, and through your local health department. Okay, the prevention is key. COVID-19 vaccination. So I know there's a lot of controversy, but here's the information. COVID-19 vaccines are effective at protecting you from serious illness and hospitalizations. Offer the best protection when you're up to date with your vaccine doses. You're considered to be up to date if you receive your original series and 1 up-to-date dose of bivalent booster. If someone did not get the original COVID vaccine series, they are still considered up to date if they have received 1 dose of the bivalent COVID-19 booster at the point of the time. Similar to the flu vaccines, it contains an inactive form of virus, and it's typically recommended for most, and there are different variations of the vaccine available. You will not contract COVID-19 from the vaccine. And again, flu and COVID vaccines can be given at the same time. However, not always recommended. However, speak with your healthcare provider to find out what is best for you. Some additional information about the COVID-19 vaccines, just in case you guys want to know. People who are unable to choose not to get people who are unable to, or choose not to get the recommended mRNA vaccine are up to date when they get a Novavax COVID-19 vaccine doses approved for their age group. The people who are unable to maybe the ingredients or they choose not to get it right away and our mRNA vaccine, then you can choose something different, but another form of vaccine, which is the Novavax. People who get the Johnson & Johnson COVID-19 vaccine are up to date when they get 1 updated COVID-19 vaccine. To be updated on your COVID-19 vaccinations, everyone age 6 years and older, you're up to date when you get 1 updated Pfizer or Moderna vaccine after the first 2 doses. Children aged 6 months to 5 years who get the Pfizer vaccine are up to date at age 6 months to 4 years and get 3 COVID-19 vaccine doses, including at least 1 updated COVID-19 dose. Age 5 years and get at least 1 up-to-date COVID-19 vaccine dose. Children aged 6 months to 5 years who get Moderna vaccine are up to date with 2 Moderna COVID-19 vaccine doses, including at least 1 updated COVID-19 vaccine doses. So, just a reminder, flu and COVID vaccines can be given at the same time, but not always everybody recommended, depending on what your healthcare provider recommends. So again, prevention is key. RSV vaccination prevention. There's only a vaccine available for those 60 years and older. Pregnant women between 32 to 26 weeks of pregnancy. to protect their infants or adults with certain underlying conditions. So you got to speak to your healthcare provider if getting RSV vaccine is something you're eligible for or recommended for you. For most people, RSV only causes mild cold-like symptoms, so prevention recommendations are to follow the standard hygiene protocols like covering coughs. And remember, do not cover your cough with your hand like this because then you're touching surfaces and you're spreading the infection, right? So what you want to do is cough in your elbow, okay? And sneeze like and sneezing, even with coughing and sneezing. So it's when you're coughing and sneezing, don't cover. Use your inner elbow. Washing your hands often with water and soap, which is better than just using hand sanitizer. Avoiding close contact with others and cleaning frequently touched surfaces. So prevention is key. General respiratory hygiene, coughing etiquette. You'll notice that most of the illnesses we've touched on today that are few common themes in prevention with all of them. One of those is the general practice of respiratory hygiene and coughing etiquette while ill. From an example of what I showed you is how to do it is like again, I'm gonna say it, coughing or sneezing in your inner elbow, washing your hands, and when unable to wash your hands, you can use the sanitizer with at least 60% or greater alcohol content after sneezing, coughing, or handling something that may have been infected. If you're coughing and or sneezing, wear a mask and when possible, avoid crowds. Please be considerate to the people that are around you and your community and co-workers and family members, even though you may not see the point of it, have the sympathy and the to prevent it from others getting it because maybe somebody has immunocompromised disease and getting a simple cold or flu can be something really scary. Just a thought. And finally, use tissues to help contain those sneezes and coughs, meaning those respiratory secretions, and dispose of them in the nearest garbage. Please don't keep your dirty tissues in your pockets and to reuse them. Please don't. Because then dirty tissue, da 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 da, you put it back, and then you're touching dirty surfaces. A respiratory droplet high-speed camera video. Um, you can once you get the slides, you can like type this in your search bar and you'll see it. But let me see if I can click on it. I don't know if you're going to be able to hear anything, but watch this. This video is produced by the University of New South Wales, Sydney, in Australia, that shows the different respiratory droplets that can occur when talking, coughing, sneezing, how different types of masking is important when secretions. As you can see, using masks while you're experiencing respiratory disease can help to contain some of those particles to help prevent those illnesses. So for example, coughing. Sneezing. Okay. And This is another video that shows something similar. So it's a similar video, but it shows out counting on how far the length. Okay, so what's on your hands? Another prevention key is hand hygiene. Hand washing can prevent 1 in 5 respiratory illnesses. You should perform hygiene regularly, but particularly after having contact with respiratory secretions or after touching objects that have been handled by someone experiencing symptoms like if they're sick, you're gonna want to wipe your hands on the surface before you touch it. Hand washing with soap and water is best, especially if your hands are visible, soiled, or use 60% of alcohol-based hand rub, but it's always better and also kills more germs by using the water and soap. And a lot of people sing the birthday song or that CPR song for the length of time of washing your hands. So hand washing procedure should take about 40 to 60 seconds, not a second. Scrubbing should take 20 seconds. And an easy way to keep track on it, like I said, happy birthday, and sing it to you twice. That's right. I forgot about that. After you finish washing and drying your hands, use the same or a new paper towel of grasping the doorknob when exiting, or I tend to use the sleeve if I'm wearing the sleeve. Doorknobs are high in use and high touch surfaces, so it is going to be contaminated by a previous person who has something. Avoid touching your eyes and nose and mouth as they can be introduce your body to germs. Especially if you don't can't wash your hands or use sanitizer, those are also easier access to introduce those germs to your body. This is another video. Let's see. This video, developed by our own infectious disease department, shows how to hand wash effectively. These are some additional visuals on hand washing that were developed by the CDC and the World Health Organization, also known as the WHO. So we first our hands are dirty. You gotta wet them. You gotta get soap, scrub them, rinse, dry, and then your hands are clean. That's a simple way to know, especially if you want to show it to your kids. Um, and then to get even more precise, especially in your general basis to learn how to hand wash properly, as well as a provider or nurse or medical provider knowing this exact hand washing routine that the WHO expressed is essential. But a lay person needs to also know how much of a hand scrub and how to as well. So prevention is key. The favorite three words. Practice good health habits. Finally, practicing general good health habits such as managing stress and exercise and eating well-balanced diet is important in maintaining healthy immune system. I know I sound like a broken record. I know. But I want to again stress that you should clean and disinfect frequently touching the surfaces at home, work, or school, especially when someone is sick. You should also avoid sharing cups, bottles, utensils, cosmetics, and other objects by which bacteria and viruses can be transmitted between people. And if there's one thing to take away from today's program, wash your hands, especially when it's visibly soiled, like visibly dirty. Those general good health habits include get plenty of sleep. Sleep that needs can vary person to person based on age and other factors. Generally, the recommendation is 7 to 9 hours for adults. It also can vary and depend also if you have sleep apnea. Also, another good health habit is be physically active. The general recommendation for physical activity is 150 minutes per week or 30 minutes 5 days per week, which makes it sound less crazy. Check with your healthcare practitioner about any restrictions you may have, or medications that may impact your ability to do physical activity. Walking is a great activity for most, and most of us can do it. Manage your stress. This is stress. Manage your stress. This is one can be tricky for some, especially what family situation, work situation you have. It also depend that will vary depending on the person. However, exercise and sleep can help with those stress management skills, as well as finding other activities that work for you. Drink plenty of fluids, which doesn't mean sugary fluids though. Eat nutritious food, like water and nutrient needs can vary by life stage, medical condition, etc. Avoid smoking and secondhand smoke if you can. If you or a loved one are currently smoking and would like more information, we can help, especially our department. There are plenty of national, state, and local resources you can use, but us in community health, we have as a quit smoking group. And as Ashley read at the beginning of the presentation, that's the information you can, if you or a loved one or be interested in joining our smoking cessation group. So, do we have any questions? Oh, I love the little picture. And
Well, I'd like to say thank you all for joining us today. If you could take a few minutes today to answer our survey, that would be great. It helps us with future programs. If you have any additional questions or comments about today's presentation, you can send us an email to communityhealth@atlantichealth.org or call 1-844-472-8499. You can also register for future classes and programs by visiting atlantichealth.org/events. That concludes today's webinar. A special thank you to Melanie for sharing your expertise today, and I hope you all have a great day.